Thank you, Daniela, and good evening, everyone. I'm sorry we cannot see each other, but hopefully it will still be an interesting presentation for you all, and I'm looking forward for some of your questions towards the end of the presentation. Let me just share my screen so at least you can see the PowerPoint. So, okay, can everyone see this? I'm thinking that's a yes. I'm Charlene Aquilina. I'm a clinical psychologist and a family therapist, and I work closely with Positive Parenting Malta, supporting psychoeducational material that we upload on our page, and also responding to any Facebook queries. Sometimes we receive queries from parents themselves who would like some guidance on how to approach their children, their partner, and also their adolescents. In various situations. So today's presentation will be dealing with supporting parents in dealing with children's challenging behavior and what tips and support you can give as medical professionals. I am aware that most of you are enrolled in the medical course, so I'm hoping that this presentation will help you add to the bag of knowledge, especially when it comes to dealing with parents and children. So this is the session outline. I will be describing what is challenging behavior, what to look out for with regards to maybe possible differential diagnosis. We will also be looking into genograms about relationships and connections, a definition and some more understanding on what is positive parenting, and some practical tips that you can give to the parents that you see. As well, I will be mentioning the local services and support available. So, Positive Parenting Malta is an offshoot of the Positive Parenting campaign. It's a national campaign which started in 2018 when there was the Positive Parenting Task Force. It was set up, and it is part of the National Strategic Policy for Positive Parenting. It is led by the Ministry for Social Justice and Solidarity, the Family and Children's Rights. And as a task force, we held regular meetings to see how best to implement this strategic policy. I invite you, in fact, to like our Facebook page, which is called Positive Parenting Malta, and to also visit our website, which can be found on our Facebook page. So let's start a bit about the importance of psychoeducation, which is something we hold very closely and dearly as Positive Parenting Malta. So our aim is to continue to provide psychoeducation and support to all parents of different strata of society. We understand that every parent is worthy of being given evidence-based information and support to raise healthy and happy, stable, emotionally secure children who will eventually become successful adults. Okay, so let's think a bit about challenging behavior and how we can see this in toddlers and young children. So we understand that young children experience a range of emotions and they express themselves in many different ways. It's important to understand that young children and toddlers, it is completely normal for them and understandable that they experience meltdowns or what we call tantrums, because as we're going to discuss, the brain is still really young and it will still be developing its impulse control strategies at such a young age. So it is important that when we are speaking with their caregivers to give them psychoeducation about how the brain is developing and how biologically certain children are not able yet to control their emotions, and that it is our job as caregivers to support this development in our children. I will go into this later on in my presentation. Let's think a bit about signs and symptoms of challenging behavior. So we know that what is challenging for me might not be challenging behavior for you. So different families will have different expectations. They're coming from different cultures. Some might say defiance could be labeled as challenging behavior or fussiness or hurting other people or excessive anger and also tantrums. So what I was saying is that it's so important that as medical professionals, we remain curious, we remain empathic and respectful in our conversational approach that we adopt with the caregivers and the children themselves. We need to understand it's very helpful that every child is different. And it is also helpful to adopt a reflective position. So from your experience as medical trainees, maybe you can think about what comes to mind when you hear the word challenging behavior. And what are your expectations of that, of seeing some children labeled as challenging behavior in the clinic or at hospital? And what's your experience of this? Because the way we story our expectations and our experiences will make a difference on how we're actually going to experience the here and now. It is also helpful to think about what the parents understand by challenging behavior, and also how is such a label affecting the child and the family. I'm not the one who is most in favor of labels. I think they can be quite harmful, especially when the child is labeled in a negative manner, and it could lead to a sort of self fulfilling prophecy of remaining difficult and challenging throughout life. So, as I'm going to be speaking later on, how important it is to also understand the positive and to also adopt a gentle and positive parenting approach. I will go into this later on. But keeping in mind, okay, the meaning of challenging behavior, it is also important to understand the child's context. The child does not live in a vacuum. So when the parents bring you a child, fix him or fix her, it's helpful to understand that this cannot be done. We need to look at the whole system. We need to look at the whole dynamic. What is going on relationship wise, context wise? Maybe was there some sort of change? Was there, how is the development going? How is the relationship between the siblings, between the parents? How does the child behave differently in different contexts, such as school or extracurricular activities? That could also give us a lot of information. Some children might, for example, be very well behaved at school, but then be very challenging at home. So that makes you even more curious to find out what might be going on at home. So, as trainees, it's very important to keep in mind that all behavior is serving a function, and it is our job to try to understand the function of that behavior. We are like investigators with the parents to try to support them better in managing the behavior of the children and to build a better relationship with their child. These are very important points as well. So, as I mentioned, behavior is a metaphor for communication. Not all children can be verbal about what's going on in their head and in their heart. So, sometimes it's easier to throw a tantrum rather than to say, I am feeling sad. Maybe they don't have the vocabulary to say that now. So, it's even more important as parents to regulate them, to calm them down, and to teach them this vocabulary. It's also very important to build bridges with schools and families. And it's also important to understand that the parents or the carers are very powerful agents for change for their children. We cannot just treat the children, we need to understand the family system. And keep in mind that every child can flourish and develop their individual strengths and make a valuable contribution to society. So, what can cause challenging behavior? So, it can be a result of anxiety, anger, feeling overwhelmed, getting attention. So, for some children, getting negative attention may be even better than no attention at all, because at least mommy or daddy are actually looking at me and giving me attention rather than not being present, for example. Children might not do this in a conscious way, so it can be something as well unconscious or subconscious that they're doing. But every,
Charlie, sorry,
yeah,
can I just interrupt you for a second? The slides aren't moving when you're sharing the screen. Have you moved forward a slide yet?
can you see this?
So we're still stuck on the first slide here.
So what are we going to do?
Can you try just? Oh, here we go. Yeah, we can see it now. We're on the right slide now.
Better like this?
Yes, yes, perfect.
Shall I leave it like this?
Yeah, perfect. Yeah,
Okay, let's try moving it.
yeah, that's working. Okay,
All right,
thank you. Thank you.
let's leave it like this. Thanks for telling me.
Thank you, Shelley.
Okay, so yeah, so other causes might be, feeling unwell, not getting enough sleep, too much screen time, poor diet or feeling hungry, and the change in family circumstances or routine, which includes obviously separation, moving country, and so forth. New baby in the family. So sometimes, apart from this, there might be neurobiological issues which might be important to look into. So it's important to refer to the GP or pediatrician, to have a global assessment, developmental assessment, and maybe also involve other members of the multidisciplinary team, including the psychologist, occupational therapist, speech therapist, physiotherapist, etc. In Malta, this can be done at the Child's Development and Assessment Unit, and it can also obviously be done privately. So challenging behavior. So it is up to us as parents, as adults, as medical professionals, to try to understand the children's behaviors and to help them learn to express their feelings in an appropriate way. So children are not born with the capacity to regulate their emotions. It is up to us to teach them to regulate. So this can be done. I'm going to mention it later on in some positive parenting points. So it's important to keep this in mind that it needs to be taught. It doesn't mean that if a child reaches a certain age, then automatically they are going to be blessed with this ability. It doesn't happen that way. It's a lot of hard work. As medical professionals, we need to think about developing a more in depth systemic interview. What I mean by systemic is the focus on the whole system, the whole family relationship system, and the culture which one is embedded in. So, this can be done by drawing the genogram. There are a lot of digital apps nowadays as well, which one can download, and they have a lot of good options. It's important to ask about the family relationships. Questions may include who is closest to whom and how come, who laughs the most, who tends to cry the most, etc. And then there are also attachment related questions. So, who supports whom? How do you calm your child down? And from where did you learn these techniques? How do you show your child that you love him or her? How often do you praise your child? And what is your child good at? It's important to avoid problem saturated talk, especially when you have the child in front of you. So a lot of parents will come and they would want to vent out all the problems that they are experiencing with their child. If the child is present, this could be quite harmful. So I would suggest trying to split the session in two, having the parents on their own and then having the actually in three is better, having the parents on their own, then having the child, and then having them both together. And that way you can actually get a lot more information. Catching the child being good rather than only looking at the difficult behavior. What happens when your child misbehaves? How do you discipline your child? And how do you help your child to calm down? I mentioned this earlier on. So it's important that you give the child a safe space to voice his or her emotions and thoughts. And this could be also done in drawings. So when there are those children who maybe are a bit averbal or who are emotionally shy, you can support them in, giving them papers and colors or a pencil and getting them to draw their emotions. It works a lot with children. They might feel a bit safe actually doing that. It is also important that you discuss the limits of confidentiality when you are talking with the children. So you need to tell them that what they're going to tell you, if it's something dangerous or of harm to self or others, that you'll have to discuss this with your team and with the parents. It's important that you do this because you don't want to break the child's trust or that the child feels in some way betrayed, because that would be very harmful. It's also important to understand the context and any major events, including cultural differences, and as I mentioned before, different contexts, different people, etc. This is an example of the genogram I was mentioning before. You can find more information online, so you can just draw it digitally or even in hand. You could use, symbols, so it's faster that way, and it's easier to communicate as a team, especially if you're using the same program. And in a snapshot, it can actually give you a lot of information about the family. I find it very helpful. So during the in-depth systemic interview, it's very important that you actively listen and observe the nonverbals. So try to see who is sitting next to whom. How does the child look? Who is talking or not talking the most? Who is making or not making the most eye contact? How is the tone of voice? And so forth. We know that 90% of our communication is nonverbal, so obviously the nonverbal is very important. Connect with the family, what's working or not working, what have they tried so far, what are they most concerned about. Offer reframing and also focus on what is still connecting the family together. For example, you might reframe overprotection as a sign of deep love. At the same time, it would still be helpful to discuss with them the importance of how to foster more independence. So, adopting the both and position, we call it in family therapy. It might be also helpful to bring other voices in the room. For example, if your brother were here, what would he say? Or if grandma was here, what would she say about this? And this helps us to get a richer perspective of the situation and the relationships. Obviously, it's also important to offer evidence based psychoeducation and support. We'll be going into those. And to adopt a non judgmental approach, be empathic, and give genuine positive feedback as well. We empower the parents and help them to reflect, and we liaise with different professionals. It's important that we liaise, we communicate. The more bridges we build, the better treatment we're going to offer to our patients. Other things to look out for in our visit might be what parenting approach are the parents adopting? How harmonious is the co parenting relationship? So, even if the parents are no longer together as a couple, we still need to understand how they are co parenting their child. These are the different parenting styles and co parenting relationships. So, when it comes to parenting styles, we look at the authoritative, what we call nowadays positive parenting, and nowadays even gentle parenting, authoritarian, and permissive. With regards to co-parenting, there is harmonious, so these are harmonious. The couple relationship might still be in conflict, and it's so important to maintain a united front for the child's well-being. It's so crucial to keep in mind that you cannot support the child effectively unless you also support the family system. Today we're going to focus on this style, okay, the positive parenting approach. So, positive parenting focuses on building a connection and a healthy relationship with children while also providing children with boundaries, natural consequences, and structure. Positive parenting recognizes the importance of discipline and developing a sense of respect to authority. However, there is a strong emphasis on moving away from physical discipline or aggression, which research has continuously shown that this results in a feeling of unsafety, insecurity, and fear in children, which obviously does not augur well for child's development and future relationships, even academia. So, what are the important pillars in positive parenting? These are three of the most important ones. So, there is empathy, understanding, and respect. So, with empathy, it is putting yourself in your child's shoes to understand what needs or emotions are causing their behavior. With understanding, you are considering your child's needs and behavior in the context of their developmental level and emotional maturity. For example, While throwing oneself on the floor and sobbing may not be how an adult responds to frustration, hopefully not, it is more acceptable for young children because their abilities to regulate their emotions are limited. The other pillar is respect. So, treating your child how you want to be treated. Parents focus on teaching and guiding rather than dictating, and they avoid commanding, criticizing, or punishing or forbidding. We'll go into this. An example might be when you throw sand at someone, it can hurt them and they might get upset. Can you practice throwing sand in this bucket instead? So, other points of positive parenting is the idea of listening and attuning, being firm but loving, being consistent. So, obviously, we are not saying we are perfect parents. No perfect parents exist, and it's important that in your clinic you verbalize this. You verbalize how important it is that we are good enough. The good enough parenting mentioned by Winnicott, who is a psychoanalyst and a pediatrician. Being consistent, so understanding the reason and function behind the children's difficult behavior, highlighting the child's strengths, providing praise and catching children being good, supporting children in their areas of growth, modeling respect, being empathic and containing of emotions. A child who experiences nurturing and responsiveness is able to devote their energy to growing a larger prefrontal cortex, and that is the part of the brain which is responsible for emotional regulation. And these children are more likely to become calm and emotionally stable adults. Why? Because their early experiences of interdependence and responsiveness suggest that their world is safe and that they can rely on those around them. So these children take for granted that they're going to be connected and be showed affection with their parents and that their attachment needs will be met, and so they are more likely to develop into mature and stable adults. And also less mental health issues are likely to be seen. So, sometimes discipline is often confused with punishment. What the word discipline actually means is to teach. Okay? So instead of punishing your toddler to teach them a lesson, focus on teaching your toddler skills so that they learn self control. And this sort of psychoeducation might be helpful, when parents come in clinic or hospital saying that their child is exhibiting challenging behavior. So punishments are focused on using control to make a child comply to your agenda, whilst teaching skills is focused on nurturing development, so a child can learn to regulate their own behavior. These are some pitfalls of punishment. Okay, so shame, blame, guilt, judgment, fear to change behavior, isolation, breakdown in connection and trust. Okay, remember, we need to look at the long-term scenario, not just the short term. And when we teach children, the long term is much more probable. Okay. So negative discipline can be harmful. Physical discipline is anything that is done to a child to cause pain and discomfort in response to their behavior. Many studies have found that physical discipline can have long-lasting negative effects on a child, including increased aggression and antisocial behavior, teaching children that violence is okay, low self-esteem, mental health problems, and the poor relationship between the child and the parent. So when you are in your clinic and you're seeing the child with challenging behavior and their family, try to understand how they're disciplining their children. Is there any physical violence? How is this affecting the dynamics? And obviously, if there is physical violence, you are obliged to report to the social services so that a further assessment can be done, with the social workers there. These are some ideas you can discuss with parents about ways to prevent a tantrum. So you check the food and water intake. If children are very hungry or not hydrated well, they are more likely to engage in a tantrum. Avoid over or under stimulation. Make sure they're getting adequate sleep. Help them, teach them how to label their emotions and give them choices. Distraction might be helpful sometimes. Connection and empathy. And use positive language rather than negative one. I'm going to go into that as well. So, for example, positive parenting and communication. So, imagine your child is reluctant to start a task. So, you can ask, are you ready? Are you going to tidy up your toys now or after dinner? Are you going to do your homework with a pencil or with a pen? So as you can see, we are not saying, would you like to do your homework? We're assuming, we're giving them, the idea, the subliminal message that they are going to do their homework, but it just depends when. So before or after, with a pen or with a pencil. But giving them the choice helps children feel more empowered. And when they feel more empowered, they are more likely to cooperate. It's important that we use a matter of fact calm voice, so it's either finished, tidied now, or after dinner. Your toys need to go away, not or during TV time. It might also be helpful to use thanks, not please. For example, when you say please too often, you may sound like you are pleading. So maybe you can say, Billy, socks on, thanks. Jane, wait until I'm finished talking, thanks. Luke, shoes in the corner, thanks. So you give the instructions and then confidently walk away with the expectation that your child will comply. Consider when best to say no. For example, um, sometimes you have to say no, obviously, but there are other times when you can use other words. For example, can I have TV on? Yes, as soon as you've done your homework. So you don't say no, you cannot, you haven't done your homework yet, but it's different. You are creating a different ambience with your child. Can I go to the shops today? Yes, you can go to the shops, although not today. We can go on Tuesday, for example. Can I have a biscuit? Yes, as soon as you've finished your sandwich. Can I have that toy? Yes, you can when you're done your jobs this week. I want Ellie to come play today. Yes, she can come around, or no, not today. She can come tomorrow, for example. When then might also be helpful. So when you are dressed, then you can have the television on. When you've tidied your toys, then you can go to the computer. When you've brushed your teeth, then we can have a story. Reframing. So reframe instructions positively. So we often give children ideas of what to do when we are trying to get them to stop. So example, don't jump in that puddle. The child thinks, I will jump in that puddle. So you can try, stay out of that puddle, thanks. Walk, thanks, okay, rather than don't run. Stay with mom, thanks, rather than don't walk off. Put that down, thanks, rather than don't throw that. Notice and praise. Be constantly on the lookout for good behavior rather than the bad. Name and praise the good behavior. I've noticed how nicely you are sharing. It's really lovely to see you being so nice. So it is genuine, okay? We don't just praise for nothing, but we try to see the detail in the behavior that we are praising and sharing that with our child. You cannot overdo praise, you cannot overdo positive attention as long as it is genuine. These are some discipline strategies you could also share with parents. So you provide physical guidance, praise good behavior, remove the child from the situation, and ignore mild misbehavior. So what I mean by provide physical guidance, if with regards to, for example, animal care, you pet the cat gently and you help them pet them gently. You teach them how. Gentle touches. They need to be guided. Remove the child from the situation if things are getting out of control. If you noticed it before, it's actually better because prevention is better than cure. Okay. And when praise, choices, and other techniques fail, then natural consequences are important to maintain structure and positive discipline. What do we mean by natural consequences versus punishments? I think this is very, very important for you to take note of because research is showing how much more influential and positive it is for the child's development to experience natural consequences when compared to punishment. So, psychoeducating parents about this is crucial. So, let's see. Making the punishment fit the crime. So, what I mean by this? So, if your child is constantly refusing to put their bicycle away, removing television privileges is not a natural consequences because actually, no, how are they linked with each other? So, however, removing the privilege of using the bike until they learn to put it away is. So, child rides his bicycle out to an agreed area and he loses his bike privileges for 24 hours, for example. Or child is throwing a ball in the house and he breaks a lamp, he has to do chores to earn enough money to pay for a new lamp. So as you can see, the natural consequences are very much related to the behavior in question. And that helps the child understand how, what sort of behavior is expected from them. And they are also understanding how to repair. And repairing is an important factor in any human relationship. So, if we want our consequences to work, there are two parts to related consequences. So, it needs to be instant in time and related to the behavior. So, the consequence needs to be implemented instantly. For example, the brain cannot just make a connection between, for example, losing ice cream 6 hours late, 6 hours after hitting his sister with the car. And when it's time for ice cream 6 hours later, there's going to be a huge meltdown. His mind has forgotten all about the toy car incident, and now he's confused, mad, growing more and more resentful, and that turns to more meltdown, so that you are, in a vicious cycle. So it's important that it is instant in time and then you relate it to behavior as I mentioned earlier on. For example, if the toddler or the child is hitting someone with the car needs to go away and we can try later. If the child is throwing food on the ground, the food needs to go away. This is a Maltese quote that we use on our Facebook page. I can translate it. So remember, helping our children express themselves is helpful, for their development. As I mentioned, this is not something natural. This is something that needs to be taught. So ways of doing this, especially when it comes to challenging behavior, could be helping parents label the emotions. So suggesting that they label what their child might be feeling. So if he's throwing a tantrum or being challenging in a different way, you might say, it seems that you're feeling sad right now, or it seems that you're feeling angry right now. Verbalizing this on a consistent level, obviously, and verbalizing your own feelings as parents, acting as role models, will give the children the vocabulary to eventually start expressing themselves. Obviously, this requires patience and a lot of repetition. Rome wasn't built in a day, and even our neural pathways are not built in a day. This is another quote. So, what can you say instead of stop it or stop crying? You can say, you look sad. It's okay to cry. We are here for you and we love you. And this sort of approach will give children the safety nets to understand and express their emotions and be more open to learning. When children feel safe and understood, their energy would be more positively invested and they're more likely to gain control over their emotions and thoughts. And this will lead to better behavior. Okay? I find this iceberg very fascinating. I use it both with adults and children, okay? So this is called the behavior emotions iceberg. So on the top part, the tip is the behavior that you can see, the challenging behavior in this case, okay? Might be, for example, throwing an object. But underneath, there is a whole other, part of the iceberg there. This is what we need to explore, the underlying emotions. The fear, the embarrassment, the grief, trauma, insecurity, and so forth. And sometimes showing such a visual images to parents may be very helpful. Okay. Other ideas might be, it's super crucial to discuss this with parents, is that it is not a, during a tantrum, the mid tantrum is not the time for teaching or negotiating, reasoning or punishing. The mid tantrum phase is there to support your child in calming down. Once the child is calm, then you can help them, reflect on their behavior and their emotions. You can think of ideas with them, what are some things you can do when you're feeling angry? Stomp your feet, take lion breaths, angry choke. Tell her, if she sister took the toy away, tell her that you're not done with the toy yet, or blow bubbles. These are the things you can discuss with your child. Okay, these are some other ideas. So don't yell to be heard over a screaming child. Validate their feelings, not action. So I can agree, I can understand your feeling, but not agree with your behavior. It is okay to feel sad, but it's not okay to hit. Don't try to reason during a tantrum. Be aware of your body language because that speaks a lot. And if you're trying to calm them down, you first of all need to be calm yourself as a parent. Respect personal space. Get on your child's level. Use a distraction and acknowledge your child's right for refusal, as well as reflective listening. Okay, so these tips can all be found on our Facebook page. So even if you direct parents to our Facebook page, it could be a good resource. Another point to make is to be mindful and containing of your emotions as parents. So as I mentioned, if we are not calm, if the parent is not calm, they cannot calm the children. So when you are dealing with parents in your clinic, it's important to explore how they are dealing with stress, how they deal with emotions, because it will also impact on how they're going to regulate or not regulate their children. Sometimes, when parents are very stressed or very anxious, they might make the challenging behavior even worse. I find this quote to be very important. So, when little people are overwhelmed by big emotions, it is our job to share our calm and not join their chaos. As I mentioned, the toddler self regulation is still under construction. So it is our role to help them with this. And it's also important to educate ourselves so we interpret behavior in a more realistic way. So instead of saying he's so naughty, I cannot stand him, we might say he is having a hard time accepting this boundary, and this behavior is making me feel so tired. That already instills a different feeling in us as parents. Okay. Another important point to make is to substitute time out with time in. The idea of time in is to help them regulate, to help them learn the skills to regulate their own emotions, okay? And to build empathy skills and to help them reflect on their own choices. So, how do we do this? We do this by, first of all, maybe having a quiet space to be with your child during um, a big feeling that they might be having, to label their emotions, to help calm them down using techniques that I mentioned, bubbles or pop ups, toys, or drawing, um, etc. And then reflecting with them on what is going on. You can actually narrate what you saw. For example, you were playing with the car and then you got upset that Sarah took it away. What can we do in this situation? Let's explore, let's brainstorm together. So, we are not punishing children for experiencing emotions because experiencing emotions is understandable, okay? We are trying to help them understand their emotions and manage their behavior more effectively by controlling and coping with their emotions in a better way, if that makes sense. I'm not sure we have time for this. I don't think so. But the idea of providing a calm down zone. So you can suggest this to parents, having a calm corner in the home. There are also good videos on this, or you can look at them or suggest to parents on this to support the children in self-soothing. A very important thing to mention here, it doesn't mean that you do a calm down zone and you leave the children to it. Okay, it doesn't happen that way. You still need to be with the child because sometimes the parents would have this expectation and they would feel let down with this method. We cannot just abandon our children. We need to calm down and then be present with our children. Okay. This is another important quote. So, as adults, it would be incredibly hurtful to be ignored or worse, sent away during times of distress. So, why would that ever be effective discipline for our toddlers? No one deserves to be punished for their emotions, eh? This is an important pyramid. This was taken from the program Incredible Years by Webster Stratton. And just like the food pyramid, the idea is to use as much as possible these behaviors down here and as little as possible the behaviors up here. So we give ample empathy, attention, play, problem solving, listening, and talking, but we are very cautious on when to use the natural consequences, okay? This book can be easily found online as well. Okay, so it's also important to remind parents of what children need more of. Children are children, they need play, hugs, nature, sunlight, freedom to explore, etc. Because sometimes the expectations that parents place on children are too much. Okay. Um, okay. Also, as a side note, it's important to support parents in their reflection. So, as I said, you can ask questions even during the interview you have. So, when you experience stress, how do you handle it? Your child is watching. When your child experiences stress, what level of support and encouragement do you offer him? In our sessions as psychologists and therapists, we also encourage the parents to reflect on their own parenting and what they've learned and like to do differently from their own family, nuclear family in the past. This can help them think a bit more about their current family and what approach they're using with their child. It's important to support parents with their stress because they might be stressed, especially, when they are experiencing their child as being challenging. And you can maybe explore with the parents on their coping strategies and their support system. It's very important. And helping them understand that having time and energy matters, okay? Energy cannot be created or destroyed, but it can be transferred from one thing to another. So if the parent's bucket is so full that they cannot have the time and energy for their child, then they need to rethink about how they are investing their time and what they can do differently as a team to support their family better. Okay, so for example, if you're having trouble, if it requires time and patience, if you want their child to learn how to put on their shoes, obviously, and you're in a rush, that's not the best time to do it. But if you have time, obviously, that should be okay because it's going to take a longer time and you're willing to be patient and you have the mental energy to do that. It's also important to understand that asking for help is a form of self care. So, suggesting and encouraging parents to seek support, even on a psychoeducational level. And these are some of the local services that we have available, all right? So, we have the Positive Parenting Malta Facebook page. There is the Perinatal and Mental Health Infant at Mater Day, the Positive Parenting courses at FSWS, Child and Young People Services SIPS at St. Luke's, and other services offered in private practice. I'd like to end with these two quotes. One of them is the way we talk to our children becomes their inner voice, so we need to be very careful on what labels we are putting there. And one day your child will make a mistake or a bad choice and run to you instead of away from you. And in that moment, you will know the immense value of peaceful, positive, and respectful parenting. Okay. That's it from my end.
Thank you, Charlene, for that very insightful presentation. Definitely some key takeaways from it as well. At this time, we can take a few questions. We still have 10 minutes. Is there anyone that would like to ask a question? Or was that all clear? Yes.
Hi, Charlene. My name is Nicola.
Hi, Nicola.
Hi. Excuse me. I have twins. They're 3.5. I have a girl and a boy. I live at home with my parents. It's been an extremely difficult situation. Me trying to be a parent to my kids, my parents trying to be a parent to me. There's a lot of conflict. There's a lot of what's the right word? Tension. My parents are not spring chickens anymore. They're in their 70s. And there's a lot of screaming, shouting, more sort of frustration that I don't know how to explain. I don't know how to express it. It comes out in a lot of anger. The difference between my kids is Luke is very quiet. He's seeing a speech therapist at the moment because his communication skills are not very elaborate, shall I say. He gets frustrated, and then within the frustration, because he cannot communicate what he wants. If I go to, for example, if I go to push him, they used to eat a lot of food, chicken nuggets. And the other day I tried to push him to eat a chicken nugget. I spoke to him about 5 times. He went to bite me not once, but 3 times. So he gets frustrated when he gets to push. Now they started Kinder 1 on the 3rd of October. And he's been to bite, I think, 3 kids at school, but he doesn't just go to bite the kids. He has to be provoked. So if they have a fight or an altercation, he'll go to bite. He doesn't like change. So I have that. Then I have my daughter, who's very different, who likes tantrums. If she doesn't get her way, she screams, she cries until she's blue in the face. I've tried, if you're naughty and put them in a corner kind of thing and wait for you to calm down, it doesn't work. I get a punch or a smack. But I have to be honest, there's a lot of aggression at home. I mean, I'm not the most patient person on the planet. So when Juliana loses her temper or she is crying and screaming, I tend to get louder and louder in, trying to calm her down. And that's how it is. It's not easy. Can you offer any advice?
Thank you for sharing that. It sounds that you have a lot on your plate. And it's definitely, it sounds very stressful and tiring to be in your position. Obviously, what I can say is that speech therapy might be very helpful, because obviously biting is a form of communication. And when he is triggered, that is the only way he currently knows. And that is how he is expressing his emotions and thoughts. So obviously, that is the function of the behavior. And you try to support that with speech therapy and the exercises the speech therapist might give you to support his vocabulary. What you are mentioning with the context, I think, is very important. So obviously, it is unhealthy, to have a lot of conflict at home. I might suggest that if you manage to repair the situation, after a conflict, make sure your child is there to witness the repair. Make sure the child is there to witness you say, people saying sorry to each other or making up or hugging it out. I don't know. So conflict is part of life. Children need to understand that reparation is crucial as well. And if something is going wrong, maybe there is aggression, you need to label that aggression is not okay. Hitting mommy is not okay. It's okay to feel angry, but not okay to hit. There is a very interesting book for children on this, possibly even for 3 years, yes. It's called Hands Are Not for Hitting. And I think it's a very helpful book. Obviously, it also boils down to how we are containing our emotions as parents and maybe understanding the culture, the situation we are in. If the situation you're in is very volatile and tiring, that is not helping you to gain, to invest your energy in a positive way in yourself and in your children. So you need to understand what might be helpful to change in your environment and how the environment can in turn impact positively on you as a parent. I guess there's much more to say on this, but obviously I encourage you to seek maybe more support on this. Hope that's okay.
Thank you.
Is there anyone else that would like to ask a question? I guess we can wrap it up here. Thank you, Charlene, again for taking the time to present today. And just a reminder to pick up your certificate of attendance on your way out. The next session will be held on December 9th. Thanks, Charlene.
Thank you and good night. Bye.
All right. Good night.